Thank you so much, Yash. And hello, everyone. And thank you for joining us today. A very warm welcome to all of you. Today, we're going to talk a little bit more than the basics of coronavirus. For those of you who are interested in the absolute basics, I made a video a couple weeks ago, and we will have that link posted at the end of this webinar. In the meantime, today, we're going to address the questions that were submitted to me on COVID-19 by the folks at Successive. And before I start, I want to say that all the answers are going to be based on what we know now. We are having so much new information coming in on a daily basis. So some of these answers 2 days later may be a little bit different based on the information that we're going to have at that time. So the questions, I have categorized them into 4 different categories, broadly speaking. The first one, I'm just going to answer a quick couple of questions about the origins of the virus. Next, we're going to spend the bulk of the time talking about how this virus is transmitted. Then there are a few questions about the severity of the illness caused by this virus. And lastly, we're going to talk about what the future holds for us in terms of vaccines, treatments, and how are we going to get out of this? And then we can open up to general questions. So the first question is the coronavirus man-made? Was it created in a laboratory or was it out in the nature? I want to give you a little bit of background about coronaviruses. The current coronavirus, the COVID-19, is just one coronavirus. There are several hundreds of coronaviruses that are currently living in animals, like bats, pigs, and camels, and wild cats. There are only 7 that are in humans. Of those 7, 4 of them cause very mild disease, like a cold. You know, maybe you have a runny nose, stuffy nose, itching, a little cough, maybe some fevers or tiredness. But it's not going to put you in the hospital with pneumonia, and you're not going to die from it. So those are the 4 mild ones. Then we have 3 nasty ones. The 2 that we know of from history are the ones that caused SARS, or severe acute respiratory syndrome, in 2002, and the coronavirus that caused MERS, or the Middle Eastern respiratory syndrome, in 2012. Now, the 3rd one that we have now is COVID-19, and this is thought to have jumped from the animals to human beings somewhere in Wuhan, probably around 2019, October, maybe a little bit earlier. All the studies that we have right now, because scientists have been studying the genome now of this virus ever since it came out, and the respected journals such as Nature are now reporting that there is no evidence to indicate that this virus was man-made or that it was created in a laboratory. Everything points to this having been in animals like the other coronaviruses and then jumping to humans after that. Of course, this may change later if we get new information, but based on what we know now, this is from Nature. So the next question is, can the coronavirus survive in hot conditions? And that's a very important question for people living in hot countries or people living in areas right now. They're looking forward to the hot temperatures of the summer and hoping that maybe the virus would just be killed. But unfortunately, we don't know that at this point. There is no consensus among the scientists. We do know that the other coronaviruses that caused SARS and MERS were sensitive to temperature. But do we know if this one is going to be sensitive? We don't know that. We just have to wait and see. And one of the reasons is that, you know, the viruses behave very differently in the lab than out in the real world. So what we do know now is the reports that this virus seems to grow and spread best in temperatures between 5 to 11 degrees Celsius. That is roughly 40 to 50 degrees Fahrenheit. So if it was fully killed by hot temperatures, then you would think that hot countries like India, for example, would have no cases. But we're not seeing that. We're seeing that there is virus activity. So we're thinking that maybe the hot temperatures actually reduce the activity of the virus. So that could explain why we're not seeing thousands of deaths in very hot and densely populated countries like India and Pakistan. That could also maybe explain why we're having a lot more cases in the United States in the cooler parts of the country, like New York State and California, and not seeing quite as much in the southern states. But then we do know that the southern states of Louisiana and Florida, for example, have high caseload of coronavirus right now, even though they are warmer. And that might be because those areas have a high number of tourists coming from all over the world, from cooler countries. But there's definitely a chance that this may reduce its activity or with higher temperatures. That is definitely the hope. Is it going to completely die down? The current consensus is that it's probably not going to. It's probably just going to become less active, like the flu in tropical India, where they have the flu throughout the year. And during the hot months, it's not quite as active. And then when it gets cooler, especially in the north, then you have a lot more flu activity. And we're thinking that and hoping that that's how the coronavirus is going to behave. The next question that I have here is the coronavirus airborne? In order to answer that question, we first need to determine what is airborne. So airborne means when the virus is dispersed in small particles, in very small particles, less than 5 microns in size. These particles are very tiny and they travel very far in the air. They don't fall to the ground. So this is different from droplet transmission. That might be the other phrase that you've heard. In that case, the virus is enveloped or enclosed in a large particle of maybe saliva or mucus. And so you cough and you sneeze and the virus is inside this large particle. And these particles are pretty heavy. So they can't travel very far in the air. They just go a few feet and then they're so heavy they fall to the ground, or they may fall and settle on the tables or on the countertops. And then you touch these droplets and then you transfer them to maybe the door handle, and then somebody else touches that and they can get infected. So that is droplet transmission. So airborne transmission is very, very, very tiny particles that do not drop to the ground and they travel far distances. So what we know now is from the way this virus is spreading is that this is primarily droplet. So primarily doesn't mean only, okay? So there is now some evidence that the virus can live in the air for up to 3 hours. And this has been shown in the lab setting. Now, one study reported that in the lab setting, but then there was another study where they looked at a person's room where this person had coronavirus infection, and there was no coronavirus in the air. So there's still a lot of unknowns here. But we do know that there is a possibility of this virus being airborne. And in that case, we do need to take precautions for those people that are at high risk, such as doctors that are performing very specific types of procedures in the hospital. For example, putting a tube down somebody's windpipe to help them breathe. In that case, when you put the tube down, lots of tiny particles are aerosolized, and then the virus can travel much further. So in those cases, the doctors do need to have that extra protection for airborne. But for the rest of us, most of the transmission is occurring through droplet transmission, through contacts, where we're touching these droplets and we are passing it on to other people. I think this would be a good time to talk about different masks. There's a lot of confusion about masks and how they protect us and who they protect. There are 3 main masks that are applicable to this situation. One is the cloth masks, just the kind that we can make at home, just the general public can wear. The other is the regular surgical mask, which is what I would put on my patient if they were coughing and they came to see me in the office. And the third is the N95 mask, okay? And that is a mask that prevents small, tiny viruses from getting through. Now, the cloth and the surgical masks, they are not fitted to your face. The air can go all around them. And these masks are really more for protecting others from yourself, whereas the N95 mask is primarily for protecting yourself from others. And I think that is a very important distinction. So if you are, coughing and sneezing, then what is best for you to do is wear either a cloth mask or the surgical mask. The surgical mask is actually much better because it has some special materials in there. It'll prevent the droplets from landing on surfaces and landing on other people. Does this mean that these masks don't protect you can't protect yourself with these masks? That's not completely true, because you could, if you're in a very crowded area with other people coughing and you don't want their droplets to land on your face, then the mask will absolutely help you. But if you're in a wide open space and there's somebody that is coughing far away, then the only way those particles are going to come to you would be if they were airborne. Remember what we talked about earlier with the airborne, they have to be very tiny to get to you. In that case, these masks are not going to help you. You would need an N95 mask. And the N95 mask has to be fitted to your face, no leaks. So as doctors, like, we can't have beards or mustaches or nose rings or anything that would prevent the mask from fitting properly on your face. And it's not a comfortable mask to wear. I have had to wear these N95 masks when I have treated patients with TB in a room. And when I go in, I can't wait to get out of the room and rip the thing off of my mask. So if y'all are planning on wearing N95 masks and strolling in the mall, I dare you to do that for very long. If it is working properly, it is an uncomfortable mask and it is not easy to wear for extended periods. The next question is, why is this virus so easily transmissible? And this really goes back to how it infects people. And let's go back to the other coronaviruses that caused SARS and MERS. SARS and MERS, both of those made people really, really sick. So they're so sick that they stay at home. And their death rates were very high, 10 to 30 times that of the COVID-19. So when you have a virus that's making people very sick, all these people stay at home. So they are not able to get out there and infect a bunch of other people. Whereas what's happening with the coronavirus is it's a very sneaky, nasty combo, because you have about 80% of people that have absolutely, very few symptoms, just like a cold, and they may not even know that they are affected. And if that was the case, if everybody had low cases of low severity of disease, and there's not a problem. But the issue is we have 80% of people running around spreading this virus to everybody because they don't think that they're sick. And then we have 20% of people that are getting really, really sick, requiring hospitalizations, having to be put on a breathing machine for days, sometimes even weeks. And we're getting about 1% of people dying. Now, 1% may seem like a small amount, but when we have millions of people being affected, 1% is a very large number. And that is 10 times as much as the seasonal flu that we see going around every year. The other thing is how this transmits. So flu, for example, transmits 1-to-1. So on average, one person with flu will infect one other person. So that is a linear progression, okay? Whereas with the coronavirus, it is a 1 to 2 or 2.5. So for every person with the coronavirus, on average, they're infecting 2 to 2.5 people. And mathematically, that is exponential. So if we did not do things like social distancing, or if we did not do things like, shutting certain things down, then this growth can be exponential, and very soon it can just overwhelm our healthcare system. Just to put this in perspective, if it were a truly airborne airborne virus, then we need to look at something like measles, for example, which has a 1 to 18 transmission rate. So for one person with measles, they're going to give it on average to 18 different people. So you walk into a room with that has a person with measles, you're going to most likely get the measles. Fortunately, COVID-19 it does not spread that way, or so far in the months that we've seen, it has not been spreading that way. All right, the next question is, what exactly contributes to the increased death rate for the people who have been infected with COVID-19? Is it just age? We found that age is definitely a very important factor in how you do when you get infected with this virus. people over the age of 80 are having very high death rates, as high as 15%. So the older you are, the more likely you are to die from the disease. But we are also seeing that people around 50 to 80 are also dying, but at a lower rate. And people between 20 and 50 are getting really, really sick as well. The death rate among that young group between 20 to 50 is much, much lower, but they are not escaping this. The people that are escaping this are people under the age of 20. Very, very few cases that are severe enough to have, to be listed as critical or to die from that. There've been a couple of reports of, I think, infants. But pretty much what we see across the board is about 70 to 80% of people that are getting very ill are people that have an underlying condition. And we find that the people that have heart disease, people that have diabetes, these are the people that are doing really poorly with this disease. Definitely smokers, people with chronic lung disease. These are, again, increase your risk of not only getting the virus, but doing poorly once you get the virus. And certainly increases your risk of dying from this. So the best way to protect yourself in the future, against viruses like this, is to make sure that you stay generally healthy and do not get, these other conditions such as diabetes and heart disease and high blood pressure, and that you don't smoke, that you don't drink excessive alcohol. There is no magic pill. There is no magic herb, no magic plant or food that is going to help you protect yourself from the coronavirus. What you need to have is a lifelong routine of living healthily, of making sure that your body is able to build up its immunity and that you can do well if you are infected with viruses such as the COVID-19. Next question is, what is more likely to hit the market first? A cure for COVID-19 or a vaccine? So based on the way that drugs and vaccines are developed, tested, and released to the market, it is much more likely that we would have a treatment before the vaccine. We're going to first see treatments for the really sick, and then we'll start seeing medication for people with mild disease, and then eventually we're going to see vaccines. Right now we have supercomputers that are, looking at 10,000 different existing drugs, and they have pulled out something like 70 possible medications. There are lots of medications that are currently undergoing trials right now, clinical trials. It's very important that we have trials on these drugs. We can't base these treatments based, we can't have these treatments based on one doctor's experience with a drug somewhere. We need to make sure that we have something called randomized controlled trial, or RCT, where basically we take, let's say 100 people, and you have 50 people that you give this drug to, and then 50 people that you give a sugar pill to. And these people are randomly chosen. So you don't choose like all the really sick people and put them on the medicine and take all the people that are not very sick and put them on the sugar pill. We need to randomize these people. And it's after we do that that we know whether this drug works or not. Right now, there are a couple of drugs that have been approved that are more for emergent use. When we don't have anything, when the person is really sick, and there's nothing much to lose, then we go and take a good guess and say, well, let's try these drugs. But we can't use that for the general population. Now, vaccines are even more rigorous because now we're exposing healthy people to a substance. So we need to make sure that the vaccine is really, really, really safe. So right now, there are several vaccines that are already been developed all over the world. And the first vaccine trial in humans has already begun in Washington State in the United States. But even though it's already begun, it's not going to come out in the market for at least 12 months, most likely 18 months. So we're kind of looking down the road here. So what does the future hold for us in a world with coronavirus? And this is my own question that I'm asking myself now. And I think in the immediate future, that means we're looking at several months to maybe a year, our life is going to be very different because we are going to have to slowly come out of this lockdown. We can't be in lockdown forever. We need a lot of tests. Testing, we need to test people whether they have the virus so that we can isolate them and keep them safe and prevent them from infecting others. We need to have tests to see if people who have got the virus have developed the immunity. Have they developed the antibodies? So once you get the virus, what happens is your body builds these antibodies to fight this virus. And once you have those antibodies, you cannot go and get it again right away. So we can send those people out into the community and help them kind of start sort of a normal life. We have to, especially here in the United States, I think we are going to see some loss of privacy, which is going to be very difficult for people, but we do have to put lives over privacy where we have to start contact tracing. So if there's a person that has the coronavirus, we have to let all the other people that had contact with this person know that they have to self-isolate so that they can stay at home for 14 days, monitor themselves, and so reduce the risk of spreading. So we don't know at this point if this is, give me a minute, I've lost my thought. So what I'm saying is right now that we have to behave as though the virus is going to be around. It's very unlikely that it's just going to die. When we come out of lockdown, it's going to be still in the community. What we don't want is a huge rush of people coming out and again mingling. Because what do I want to do right now for 2 weeks of being shut inside? I want to go out, hug my friends, be with my loved ones. But that is something we won't be able to do right away. We're going to have to, again, go back to social distancing. Maybe we can start going, some people maybe can go back to school. Some people maybe will start going back to their jobs. But we still would have to maintain social distancing for a while. But in the long term, once we have a vaccine, then we have the chance of eradicating this. We have the potential to get all the people vaccinated, and we will also have treatments by then. So I think it is very hopeful in the long run. Those were the main questions, Yash. I don't know how we're doing on time. I have some more questions here. Let me see here. In the start of the webinar, you said a lot of coronavirus is present in animals. So why has it not? Okay, let me read this again. In the start, we said a lot of coronavirus is present in animals. So why has it not surfaced in the past so many years, and why now? That's a very interesting question. And that is because these are primarily animal viruses. So for the animal virus to come into the humans, there needs to be close contact between these wild animals and the humans. And now as our world is changing, we're becoming more industrialized, we're kind of creeping in and into the zones where wild animals are, we're coming into closer contact, which is why most of these incidents that have happened are when people have been in very, very close contact with these wild animals in wet markets. You also need a mutation, a random mutation, for it to jump from the from the animal to the humans. Let me see, there is another question here. Also, does this conclude that it can happen anytime? So can this happen again? Absolutely, it can definitely happen again. The more that we are in close contact with wild animals, where we're congregating wild animals in large populations. For example, that's what happened in the wild market, we think, this time. And so like China, for example, has banned these sort of wet markets where large number of wild animals are put in a cage and where people are coming in contact with them. So I think we have to make some significant changes as a community and as a world in thinking about how are we encroaching on these wild animals? How are we getting in touch with getting in contact with these animals? And going forward, there has to be policy about that. And I think the governments are already doing that to address it. Let me look at the next question here. This virus has a big incubation period. Can we have another virus coming up with more incubation period than this one? Is the virus becoming stronger or immunity of us becoming weaker? Okay, I think there are two different questions there. First of all, is the virus coming up with more incubation period? Absolutely. There are different viruses with very different incubation rates. Some viruses are low incubation, you know, within 1 to 2 days, and there are others with longer incubation of several days, even weeks sometime. It is not at all unreasonable to think another virus is going to come around with a much longer incubation period. And this question as far as whether the virus is getting stronger and we're getting weaker, no. Yeah, actually, one of the good things is that this virus is mutating very little. Unlike the flu vaccine that mutates every year, this virus, coronavirus, has pretty much stayed the same from this time it started in China to where it is now here in the United States and other parts of the world. So it's not, and there's no evidence so far. And we have excellent, genomics now, because we can just go ahead and start sequencing these genes. We're not seeing anything that makes us feel that this virus is getting stronger. And we can't get weaker in such a short time. And, our immunity is built in. And so it's not like within a matter of weeks we're going to get weaker. It's more like if we have good lifestyles throughout our lifetime, then we're going to have good immunity. I'm looking at another question here. Hello, ma'am. What is the R0 factor and what it means for coronavirus? R0 is a scientific term, which is sort of an, this is what I was telling you about, is the number of people that it infects. That the person that the virus can be transmitted to. And that's for the virus that is 2.3, 2.4 from what I remember last. I would not be the best person to talk a lot about R0. That's more in the science field than in the medicine field. But my understanding is that the R0 is very closely related to how quickly this is transmitted. For flu, it's about 1 to 1. For coronavirus is 1 to 2.4. Or 2.3, 2.4, we are not sure yet. And for measles, it's 1 to 18. Does this virus spread by vectors like other viruses, for example, the dengue? Excellent question, and thankfully not. It is not spread by other vectors, like dengue is spread from mosquito bites. Currently, there have been 3 modes of transmission that have been identified. One is the droplet that we already talked about. The other 2 possibilities, the airborne possible. And thirdly is fecal oral transmission. That is more like those other diseases like hepatitis A and stuff, where it goes through food. So they have isolated the virus in the feces, in feces samples. So if people are not washing their hands very well, I know it kind of sounds gross, but this is very easy to get contaminated. If somebody is cooking and they haven't washed their hands really well, it can be transmitted. So there's a small percent, I think like 10% of people with coronavirus are coming in with gastrointestinal symptoms, and we're not really sure if those were people that got it through the fecal oral mode, or if they got it through the respiratory mode and then it actually went into their gut. So we're going to learn. There's a lot of interesting times ahead, medically and scientifically speaking, and we'll know more at that time. Does herd immunity help with this current situation? I think this is a very interesting question. Now, I want to first, for those of the people that are not sure what herd immunity is where the community as a whole builds resistance to a virus because so many people already are protected from the virus. So how can you be protected from the virus? There are 2 ways to be protected from the virus. One is you have a vaccine and you have vaccinated people, and then that person becomes protected. The other is the person gets the disease, they develop the antibodies, and then they are protected. So based on the various patterns in which this virus spreads, currently scientists are thinking that when about 60 to 70% of people become protected or immune, then we will have herd immunity. That means the very fact that these people, 60 to 70% of people are protected from this virus, they are going to protect the other 30%, even though they may not be immune to the disease at this point. So our best hope for herd immunity is a vaccine that is effective and a vaccine that is safe. And the other way to build herd immunity is for the younger people that they already are building herd immunity. We don't know at this point because we're not testing millions of people. Once we start testing millions of people, then we will know what is are we approaching herd immunity? Because we could have a lot of asymptomatic people right now who have protective antibodies in them already. And I'm expecting to see several of those people will be under the age of 20. So I think that's when we come out of lockdown, the people that are going to be let out first would be these people who are very young, that are not responding to this disease in the same way as the old people. And they can develop immunity, and they can develop their own herd immunity and protect the older people from getting this illness. Next question. What can we expect in the coming 2 weeks of this month with a hike in cases in India for almost 3 days now? Excellent question. I first want to distinguish number of cases from number of deaths. Number of cases is very dependent on how much you test. And number of cases of number of deaths is very dependent on how you report the people that are dying. So, for example, the United States, if you look at the United States, it looks as though like we have an explosion of cases recently. Well, it's kind of misleading, because it might just be because we had no tests available for weeks. All of February, we had hardly any tests. So nobody was testing. So the number of cases looked really, really small. And then suddenly we got a whole bunch of tests and we're testing a bunch of people. And so it's going to look like we're having a whole bunch of cases. So it's hard to know if these increasing number of cases in India are truly because more people in India are getting coronavirus, or is it just simply because more people in India are now getting tested because people now know about it and they had the symptoms? They're like, oh, do I have the coronavirus? I'm going to go get it tested. Right now, even in the United States, we don't have enough testing kits to test everybody. We're only testing people that are coming into the hospital with bad symptoms. And we're testing, there are a few drive-through testing centers. So we're starting to get some cases from there as well. But you can absolutely expect the cases to explode when we start testing more people. But always keep that in mind. Number of cases depends on number of tests that are being done. All right, next question. We are able to isolate ourselves, but we are buying daily consumption items like milk, vegetables. So okay. So I think the question is, we are isolating ourselves, but we're still exposing ourselves to, potential viruses when we go and buy things from the grocery stores, and should we sanitize this? Now, this is a very personal question, I think, because it depends on how you perceive your risk. So I think what I do when I go into the grocery store right now, I am not sanitizing my products. There are some doctors that are literally putting on a hazmat suit and, taking sterile gloves and opening their butter and washing their, vegetables with antiseptic or whatever. To me, I think right now, the way it has spread, I don't think we need that level of sanitization. And I think what we need to do is be very, very careful. So what we're doing is, when I go into the store, I am using the hand wipes and the hand sanitizer that they have there. I'm wiping down the handle of my grocery cart. I'm picking up my stuff. And when I come home, I'm immediately washing my hands, and I'm using disposable bags, unfortunately, right now, mainly because of this fear. I normally use cloth bags. I guess if you're using cloth bags, you can come home and wash them. But I am not sanitizing the vegetables, because it really depends on the dose of the virus. So we're not seeing, a lot of transmission with tiny amounts of exposure. So if you're just being exposed to a small amount of virus, this is just from what we know now. It seems like you need a fairly large exposure to the virus. So if there's a doctor sitting in front of a patient, the patient coughs on them, or you are staying very close to your daughter or son, and that person coughs on you, or you are constant. Let's say you are a maid at a home, and you are coughing, and you're not wearing a mask, and you're wiping down surfaces, and you're coughing all over it. Yes, but for now, just to give you my personal thing, I am not disinfecting all the produce that I am bringing in from the grocery store. Next question, let's see. What is the treatment for the coronavirus disease? So at this point, as I mentioned earlier, we do not have a treatment for coronavirus disease. I've had questions actually from my family in India asking if they need to be buying hydroxychloroquine, which is an old medication used for malaria in the past, but currently it's used for autoimmune diseases such as lupus and rheumatoid arthritis. Right now, medication like hydroxychloroquine, we have an HIV drug called Kaletra. We also have an Ebola drug called remdesivir. These are all in clinical trials. These are not being used for treatment of the general public. They are being used currently experimentally only, and we are using these. We're going to wait until the clinical trial results are available before it is, approved as treatment for the general public. All right, this is a very good question. Are people suffering from allergic rhinitis, pollen allergies in general, more vulnerable to COVID-19, and do they need to isolate themselves? I think these are two very different processes. If you are just a person with normal immunity, like let's say you just, a healthy person, you don't have diabetes, you don't have heart disease, and you're having allergies, and and I'm suffering from allergies, and every day I'm like, oh, is that a tickle in the back of my throat? Is that coronavirus? I don't know. No. So unless currently, if you don't have a fever, if this is your normal allergy time for you, and you are just sneezing and itchy and scratchy, that is not very common in coronavirus. What coronavirus mostly comes down with people with fever. Not everybody has a fever, but fever, severe fatigue. Usually with viruses, with the allergies, you do not have that type of fatigue. They're getting severe fatigue and a very dry cough. Allergy cough is more, dripping and draining and mucus, and you're, scratching your eyes, and there's scratching in the back of the throat. So very different. So if you have just allergic symptoms and none of the other symptoms, such as either fever, dry cough, or significant fatigue, some patients are also having aches and pains, and some people are having some diarrhea and nausea. Now, those symptoms will make you worry more about the coronavirus. And in that case, you should either depending on which country you are and what level of testing is available to you. If testing is not available to you, then just stay home and isolate yourself. And if testing is available, then do not go to the hospital unless you have severe symptoms like shortness of breath or very high fevers that you can't bring down with paracetamol or Tylenol. If you're you can go to a driving drive-through test center, and see if you can get yourself tested for coronavirus before you isolate yourself. All right, can pets catch catch the coronavirus from humans? And this is all animal lovers are worried about this, and we're worried about pets being abandoned. And so far, we don't know. From what we know, 2 cases that have been reported. One was a dog in Hong Kong, and then the other was a cat in Europe. Now, both of these animals were living in close contact with people that already had coronavirus. So they're thinking, we're not sure if the cat gave it to the person or the person gave it to the cat. So at this point, though, the CDC is very clear in saying, and even the WHO, that there is no evidence at this time that pets are transmitting this to people. They could get it, but it doesn't look like they are the main mode of transmission. So please, please do not abandon your pets. You want to behave with pets as you would anyway, because pets carry other diseases too. So, if you're playing around with your dog, my recommendation is to make sure you wash your hands after you have fed them, or if you've cleaned their litter, if you have a cat, if you've cleaned their waste and stuff like that. Just be careful, keep them clean, love on them, but please don't abandon them. All right. I'm not sure I understand that question. Okay, I'm not sure if I understand this question. Why coronavirus has infected very less compared to others in kids? I don't know if that means, if you're wondering why it is affecting kids a lot less than it is affecting the older people. And we don't really know the answer to that at this point, which is I'm very thankful for that, because a lot of diseases often affect children, affect the 2 extremes, the children and the really elderly. And we know that it is infecting younger people for sure. It's just, it's not making them very sick. And it has probably something to do with the immune response. And I know there are lots of scientists frantically working out the answers to that question. And as we know the answer to that, I will definitely share those with you. Okay, how can they with certainty say that people died of coronavirus 19 when an actual autopsy hasn't been completed? Very good question. Because right now we're just getting information of people that die, and then we know that they tested positive for coronavirus 19. So we're saying, okay, this person died of COVID-19, and we put them on the total death count. But you're absolutely right. There may be definitely cases where they might have just happened to have the coronavirus, but they might have died from something else, maybe a heart attack, but that person would be counted as COVID-19. But what we do know is that the coronavirus is creating a very specific pattern. For example, the CAT scan. The CAT scan on coronavirus patients, a very, very typical look of ground glass, and it's on both sides of the lungs. And these people have certain labs abnormalities that are looking like that is very closely associated with COVID-19. So in the majority of the cases, we are able to tell that the death was related to COVID-19. But there are other complicated patients. For example, there was a patient in my own city that died. He was 92 years old, had multiple medical problems, and he may have had other diseases. We're finding out something like 20 to 30% of people are now having co-infections. So other viruses like the flu virus, the respiratory syncytial virus, or RSV. So if they have coexisting viruses, we're like, well, did they die of the flu, or did he die of the COVID? We don't know. But if he had very classic characteristic patterns in the CAT scan showing the infiltrates in his lungs, then it's more likely that they died of COVID. But you're absolutely you're absolutely sure that the autopsy would be more essential in some cases. But I don't think we're that off in the numbers right now. I think we have a pretty good idea of who's dying from coronavirus and who isn't. Let me check here and see. What is the mortality rate of coronavirus? Currently, again, the mortality rate is very interesting because it depends. There's a numerator and there's a denominator. So the denominator is how many people have the virus. And the more people we test, the more cases we're going to find. So the mortality rate is going to go down as we test more people. So like when they started out in Wuhan, I think the numbers that were coming out of there were like 2 to 3%. And then when we started checking a lot more people and testing a lot more people, then in some of the other countries like Germany and in the Princess cruise ship, for example, the cruise ship where they tested everybody that was in the cruise ship, the mortality rates are closer to 1%. And several scientists are thinking that when everybody is tested and we know what the true prevalence of this disease is in the community, that is probably going to be 0.6 to 0.7%. And that is about seven times more than the regular flu. Someone is asking again about when this virus mutates, will it be worse? And when will humans develop antibodies to fight this on their own? So the first thing is the virus has mutated already. They have done genomics, they have done these gene sequencing on the viruses in China, the viruses in France and Italy, and there are some changes. It's already mutated. But it is mutating at a slow rate, and it has not mutated into something very dangerous. Now, since these mutating things are generally, these mutations are based on the pressure on the virus to transmit. So I don't know if I'm making that clear. So basically, the viruses acquire mutations to help them spread far and wide. The thing is, this virus is already spreading far and wide. So there is no pressure on this virus to get a mutation that will help it spread. So I am very hopeful that it will not develop mutations that are going to make it much worse than it already is. The second thing is about people developing antibodies of their own to fight this. Right now, people are developing antibodies. So when you get the virus, because the reason we know they're developing antibodies is because people are surviving. If everybody died, then you know that people are not developing antibodies. But we know that 80% of people don't die. They fight off this virus. So how are they fighting off this virus? They're fighting off this virus by making their own antibodies that are killing this virus. Now, we don't know if these antibodies are going to be with us for a few weeks or a few months or several years. We don't know. Only time will tell us. But the hope is, just looking at this virus compared to other viruses in the past that are similar to this, we think that the antibodies are going to be fairly protective. And we think that these antibodies are going to last for a few years. That is definitely the hope. In that case, what will happen is you will take a vaccine and maybe get a booster every few years. There are some viruses that you have immunity to for life. So once you get this virus, you don't get it again. And in those types of diseases, you get a vaccine only once in your lifetime. Then there are other viruses that keep changing, and so your antibodies have to keep changing, and you have to get a vaccine every year to develop these antibodies. And those are like the flu virus. We have to get a vaccine every year for that, at least as of now, where they're working on the universal flu vaccine, but it's not available yet. Can one get coronavirus for a second time? So if we're talking, there's been speculation on this because I'm talking specifically about COVID-19. And what I'm reading is that it seems very unlikely that you're going to get it again if it is the same virus strain, unless it vastly mutates to something totally different, then of course you could get that strain. But getting the same one again seems very unlikely. There were a couple of reports, I think, from China where people had tested negative and then they tested positive. And I think that has more to do with the testing rather than whether the person actually got the virus again. The reason being, first of all, we are seeing that current tests, depending on which test we're using, some of them can be give you false negative tests in almost 30% of the cases. And that is not necessarily a fault of the test itself, it's also the behavior of the virus. So the current test that we have now, we are swabbing the nasopharyngeal area. You have to go up pretty high into the passages and get a sample of your secretions there. Now, what happens is, depending on the timing, what we're finding is if you check it too early or too late. If it's check it too late, for example, the virus has already traveled from the nose into your throat and your lungs, and at that time if you're testing in the nose, then it would be negative. But then later on, if they did a test because the person is really sick now and they test their bronchial or the windpipe, the secretions from the windpipe, it may come up positive. So you could potentially mistake this for a person who got the virus again the second time when they never got well. It was just a test that showed negative in between. I hope that makes sense. All right. Is self-quarantine good enough to prevent coronavirus? Definitely, what is good enough? That's a very subjective term, but it is really at this point, until we get the vaccination, that is really the only thing that we have that we can do at this time. There is nothing more to do. So we have to self-isolate. So there's a couple of things. There's isolate and then there's quarantine. So isolate is you have a person that is sick and then you put them in a separate room and you separate them from the others to prevent them from getting sick. So that's isolation. And then quarantining is you take a person that doesn't have any symptoms at all, but they maybe have been exposed and you want to monitor them. So you quarantine them. So we need both of those to go hand in hand. We need isolation of patients that are sick. We need quarantining of patients that are well, but that did have exposure to somebody with, or probably had exposure to somebody with the virus. And thirdly, we have social distancing. And social distancing means you maintain a safe distance from the other person. And social distancing is what is going to become crucial in the months moving forward, because that is what is going to prevent us from getting a surge in cases if we all go out when the lockdown is turned off. And if we run out and begin life as normal, we're going to have a huge surge in cases again, is what we're all thinking. So when we go out of lockdown, we still need to maintain social distancing. Because there's so many asymptomatic people, we don't know. But this doesn't mean that you should be suspicious of people or be, paranoid about other people. There's only, these people didn't want to get the virus, but they have it. So, and several of them don't know that they have it. So just let's be reasonable. Let's be kind and loving when it comes to isolating people, when it comes to quarantining, and when it comes to social distancing.
Okay, so I think we are exceeding our time limit.
Uh-oh.
We are
all right.
7 or 8
all
minutes.
right, yes.
Stipulated time. So what we can do is that any of the attendees, if they have any questions that have been left unanswered, they can send to us those questions to an email ID, and we'll forward those to you so that we can answer them later. So I have just pinged that email ID in chat for everyone.
Perfect.
Please take note of it. And thank you so much for joining us today for the webinar.
Thank you, everybody. I really appreciate it. Fantastic questions. Thank you.